Good afternoon, everyone. Thank you all for being here. I'm just here to say thank you to our congressman for holding, I think it's the third and final forum, town hall meeting here in Petaluma. I really do appreciate that. I think we're very fortunate to have such an advocate out there on our behalf. I was up in Sacramento for the last 2 days. We had our CSAC legislative conference. We had meetings with the governors. We miss you in Sacramento, but I just want you to know how fortunate we are to have you in Washington, D.C. And without further ado, I do want to say thank you. I also want to recognize the mayor of Petaluma here is David Glass. Thank you for being here as well, David. And Congressman, thank you again.
Thank you, Supervisor Rabbit. It's great to be in Petaluma and great to be with all of you. Thanks for showing up, Mayor Glass. We're going to be talking about a couple of federal programs today, Social Security and Medicare. But it is important to remember that this is part of a broader issue of meeting the needs of seniors. And that's a whole continuum of needs that requires a team that includes members from local government, from nonprofits, and I'm just so grateful to have partners at all levels that are committed to our seniors. I want to begin this town hall by thanking Elise Hempel and the Senior Center for being our host. Thanks so much. And I want to thank the two panelists that are with me. One of them's right here to my right, Al Piombo. Al is with an organization that does incredibly important advocacy for seniors in all sorts of ways. He'll tell you a little more about it, but I really am grateful that he's here with me because his office is really a partner with my office. We are sort of gateways for seniors. When you run into trouble with your health plans, with Social Security, with Medicare, et cetera, you have advocates that can help you. Al and his organization are an important part of that, and I hope that my office and my team will be part of that as well. The second and very important part of our my companion team up here is just coming down the aisle, Max Richmond. Max is with a very, very important advocacy group in Washington, D.C. called the National Committee for the Preservation of Social Security and Medicare. That's a mouthful, but it's NCPSSM. And they are one of the most engaged and most effective voices in support of these two important programs. So to set the stage a little bit for the town hall, you're going to hear a few opening comments from me, then I'm going to hand it off to these gentlemen, and then we'll quickly get into your questions and cover as much ground as we can until my staff gives me the high sign in the back of the room. And normally I would be glad to hang around and have conversations afterwards. Unfortunately, I'm being taken further up Highway 101 to a meeting in Mendocino County, and so I'll have to head out, right when we're done. But I think this is being televised on
Petaluma Community Access.
Petaluma Community Access. So you will be able to see that, and you'll be able to tell folks who weren't able to join us here about that. Last thing I want to mention, just as a housekeeping item, we'll take as many questions as we can today, but if we don't get to your question, we're going to have forms that you can fill out, and my district director, Jenny Calloway, is holding one up in the back of the room right now. And I hope you will fill one of those out if we don't get to your question, and then we'll get back to you. We'll make sure that we answer your question whether we cover it today or not. So, we're here to talk about two government programs that have made a tremendous difference to seniors and really to our entire country for several generations now. And I would like to think that we'd be having this same discussion, this same town hall meeting, regardless of the politics in Washington, D.C., because these programs are so very important, especially in a district like mine, where seniors are a huge part of my constituency. They're also the fastest growing part of my constituency. So I have a little bit of a silver tsunami here, and I'm working hard to try to make sure that I'm meeting their needs. But as important as these programs are, there's even an extra reason to have this discussion about Social Security and Medicare today. And that is that because of the tough fiscal challenges our country faces, we're talking about a $16 trillion national debt, a deficit that is declining. Actually, we're trending in a very positive way in terms of managing our deficit. But nevertheless, it's about a $642 billion deficit still. And in response to those things, you have some people in Washington suggesting that with all of these baby boomers retiring, with all of this silver tsunami, we just can't afford to fully meet the needs of seniors. They're suggesting that we have to start choosing between seniors and other needs that we need to meet. And I believe a great country finds a way to address all of its needs and to meet the needs of seniors who have earned their benefits, to also meet the needs of kids and the next generation. So we're having a very important debate about that in Congress right now. And there's two fronts on which we're fighting against some proposals to reduce benefits on Social Security and Medicare that we're going to be talking a bit about here today. The first is this proposal that unfortunately the president has put on the table in his budget. He did this last month. It's called Chain CPI, and it's a very technical and complicated issue, but what it really boils down to is giving you less of a cost of living adjustment for your Social Security benefits and for other types of benefits. If you're a veteran getting disability benefits and other things that are non-means tested, Chain CPI would affect you there as well. I think it's a bad idea. I opposed it way before I got to Congress. During the campaign, I joined over 100 members of Congress in writing to the president saying don't go there. Unfortunately, he has gone there. And so I am co-sponsoring legislation to oppose it and to find other ways to make sure that Social Security remains in good shape. It is in good shape right now. It is not contributing to our debt and deficit. And there's a few things that we can do to make sure that remains the case for future generations. But unfortunately, the president has put this proposal out there, and we need to talk about it. We need to understand it. And we need to engage and make sure that he hears and that others hear that this is not a good idea. I understand this not just as a politician, but I've got an 83-year-old mom who still lives in my hometown of Independence, Missouri, and she's able to live independently, modestly, but with a lot of dignity, and that would not be possible without Social Security and without Medicare. And the reason that she's able to live that way is not just that we have this wonderful Social Security program, but that it has stood the test of time. If seniors were still getting the benefits that were offered in the 1930s and 40s, if you think about it, Social Security would be doing a pretty lousy job of providing social insurance. The reason it has been successful, the reason it's so essential, is that it has had those periodic inflation adjustments. And so when you start tinkering with that, when you start playing around with Chain CPI and other ways to try to save a few bucks by taking money out of the pockets of seniors, it's a very bad precedent that I think threatens the long-term integrity of Social Security. It does one other thing, though, that I oppose as well, and that is it sort of trivializes the impact of a few dollars here and a few dollars there on seniors who are on fixed income. And I understand this very clearly from my own mother, who simply can't afford to have $1,100 less a year as a result of something like Chain CPI. It just, the numbers don't work for her. And I know that's the case for millions and millions of Americans. The second front in which we're fighting involves Medicare. There are proposals out there like what we've seen in the Republican budget. Now, the Republican majority in the House of Representatives, led by Chairman Paul Ryan, have proposed a budget that would fundamentally change Medicare from a guaranteed coverage to a private voucher that you would take out into the insurance market and try to buy insurance and hope that it's enough to cover your needs. Lots of concerns about that, lots of concerns that it would not keep up with the rising costs of health care. And we're opposing that. I'm opposing that. I've already voted against it and will continue to do so. There are other proposals out there as well, and Max and Al and I will talk about the proposals to raise retirement ages and do other things. And so we'll talk about the importance of understanding what's being proposed. I believe in opposing those proposals, but those are primarily the fronts on which we're fighting. And with that, I want to hand off to Al, and then we'll go over to Max.
You kind of set a precedent by standing up. I want to thank you all for being here. I want to thank the Congressman for inviting HICAP here to represent my executive director, who is here as well. I am from Senior Advocacy Services. Part of Senior Advocacy Services is HICAP, Health Insurance and Counseling Advocacy Program. That's a long string. We are now located here in Petaluma. We just moved from Santa Rosa, so we're centrally based for you people. Our purpose is to help you navigate through the Medicare system, to help you find out what is going to be the most comprehensive plan for you, help you make choices. We can point out all your options, If you have questions about billing, you need help with appeals, or don't understand some of your paperwork, we are at your service. We are a nonprofit. We don't sell insurance. We don't charge anything for our counseling. We have counselors in 6 different counties that all work out of our office. We are here to help you. Remind you that open enrollment every year is October 15th through December 7th. You need to contact us and make sure that you're getting the best possible comprehensive care that you can get through Medicare. And we are an advocate for Medicare. If you have problems or questions, you can give us a call. We will try and answer those for you.
Max, I hope this can reach you.
Thank you very much. Thank you, Congressman, for inviting me. Good afternoon to all of you. I've done hundreds of town hall meetings with members of Congress over the years, and I usually learn at least one thing at the town hall meetings. And at this one with you, Congressman, I learned that I should bring my lunch with me. 'Cause I should have looked at the agenda. We had a 9 o'clock radio show, a 10 o'clock town hall meeting in Mill Valley, a 12 o'clock town hall meeting here in Petaluma, and I didn't see anything on there about lunch. So next time it's a power bar. That's okay. This morning, a couple of hours ago, at 11 o'clock Washington time, the trustees of Social Security issued their annual report. And as we expected, they said the Social Security program is sound. That means be financially sound, able to pay everybody who's entitled to benefits every penny they're entitled to for the next 20 years. And then, if nothing is done, there will be a shortfall that needs to be addressed. And we agree that it needs to be addressed, not as part of a debt limit negotiation or a fiscal cliff, which was the case last fall negotiation, but for its own sake. And there are a lot of ways to do that, and we can talk about them as we go ahead with this town hall meeting. But what we don't want to do is, at this point, cut benefits. And what your congressman just talked about, the chain CPI, is the main effort that is being talked about, and including by the president in his budget, to reduce Social Security benefits. Why? To negotiate with the Republicans to get a big deal, a grand bargain. We're opposed to that. Now, you all know what a COLA is, right?
Yes.
The trustees' cost of living adjustment, it's that little bit of money that's added on to the check every year. There's an adjustment made. It's announced in the fall. Everybody watches it because you know how important it is just to keep that check up with the cost of living, the real cost of living. The report from the trustees, and I was just looking at it, estimates, now they won't officially announce this till the fall, that the COLA under the current formula will be 0.7%. That's how much it's going to be. And the estimate in the trustees' report is usually pretty close to what's announced in the fall. So 0.7%. That's what the increase in the last year for the cost of living, according to the Bureau of Labor Statistics, is. Now, anybody think that's too much? Okay, the chain CPI, if the chain CPI were used this time for this COLA, that 0.7% would be too much. That's how bad this idea is. It would mean that there would be basically no COLA. You remember in 2010 and 2011, what was your cost of living adjustment?
Didn't have one.
Nothing.
Didn't have one.
If the chain CPI were used, one way I look at it is it would mean that zero you got in 2010 and 2011, that was too much. Because this COLA formula that's being talked about, that's in the president's budget, would change the computation. And the bottom line is, yes, the congressman's right, it is complicated. The bottom line is it reduces the COLA. How much money is involved? The president's budget that would use the chain CPI would save $125 billion over 10 years. Guess where that money is coming from? From you, from Social Security beneficiaries. That's $125 billion that won't be in the pockets of Social Security beneficiaries. That's a lot of money. And it adds up quickly because the COLA is built into whatever the base is, so it's compounded, and each year you fall further and further behind. So we're dead set against it. And I told the president himself that at a meeting at the White House. We delivered 2.1 million petitions. Ernie Powell, our grassroots director right here from California, was with me, and we carted in to the gates of the White House 2.1 million petitions from our members and other progressive groups opposing the COLA. We delivered 168,000 petitions to the House of Representatives that were accepted by about a dozen members of Congress, and 68,000 in the U.S. Capitol accepted by Senator Bernie Sanders and Senator Sherrod Brown of Ohio. So we're doing everything we can to stop this, and your congressman is doing everything he can. He has, as he said, he has signed letters. There's a letter to the president. Over 100 members of the House have signed that letter telling him it's a bad idea. We oppose the change CPI. He's introduced a resolution, a concurrent sense of the Congress resolution saying change CPI is a bad idea. And I really appreciate the fact that he signed on with a couple dozen of his colleagues to legislation that not only opposes the change CPI, but corrects the current formula. And I'm going to stop with this, and because I know you've got questions, but if you think that the change CPI is a bad idea, and I know you do, the current formula is inadequate. You know that your cost of living has gone up by more than 0.7%, right? That's ridiculous. I mean, look at the price of your food, your gas, and things your medicine. So the bill he's sponsoring would use a different formula. Not this, wouldn't go from a flawed formula to an even worse formula, but would adopt something called the CPIE, Consumer Price Index Elderly, that looks at the goods and services that seniors need, that they rely on, and measures the inflation for those things, which go up. Healthcare costs, as good as Medicare is, healthcare costs for Medicare beneficiaries have gone up twice what healthcare costs for younger people. We know that. But it's not given the correct weight in the current formula for the COLA. So thank you for trying to move the correct way to make the COLA fairer and more adequate. So I'm going to stop here because I want to take as many questions. I know you do too. Thank you so much.
Thank you, Max. All right, we're going to get right into your questions. I just want to remind you, though, that I have staff here, and I hope, in addition to what we cover here today, you will remember that my office is a resource for you. Just like Al and his colleagues, we want to help you navigate whatever kind of challenges you're facing with your health coverage, with Social Security. If you're a veteran and are having problems with veteran benefits and claims, we want to help you. So let's keep in touch, and let's get right to your questions. Yes, sir.
My understanding is that Social Security retirement benefits really was established as a safety net. And there are people that make $100,000, $500,000, $1 million, and yet they receive Social Security retirement benefits and they don't need them. Is there any reason why you couldn't have a means test for that so that people, if they made over a certain dollar amount, their Social Security benefits would decline?
I'm going to let Max jump in on this for sure, because this is always part of the debate when it comes to, how can we save some money here and there. But one of the problems I see with applying means testing to both Social Security and Medicare is that this is not welfare. These are not entitlements that we give out to people, just as a safety net. These are earned benefits that people pay into during their working years. So the fact that people of all means get to reap the benefits back from what they pay in during their working years is an important premise of the programs. It's also an important part of our political constituency, because if you whittle these programs down to smaller and smaller groups that that are covered just based on some sort of means test, you also shrink the political constituency to keep them going. So I'm very skeptical of those type of proposals, but I'll let Max speak to them.
Well, I can't say it any better than that. Turning an earned benefit, when you're working and paying into Social Security, you don't know that you're going to be making $500,000 when you age 67 or 68, or you're going to be depending on your Social Security check. You support it because it's insurance. You don't know where you're going to end up later on. But in turning it into a means-tested plan, first of all, the support will dissipate. People won't support it if that's the way it's structured. Let me ask you, how many of you are on Social Security? Okay. Anybody ashamed to be on Social Security? How many of you would be proud to be on welfare? That's what a means-tested program is. It's a welfare program. And you can see how the support for the program would dissipate. So I understand where you're coming from. But I think it's very important to make sure that the integrity of social insurance through Social Security is maintained. And I think it would be a mistake to turn it into a means-tested program.
There are also proposals, maybe I'll just use this chance to ask Max a question. There are also proposals that perhaps instead of mean testing, you might take people above a certain income level and not change the way Social Security benefits are taxed. Have you given any thought to that, Max?
Well, there is a tax on Social Security benefits right now. You know that, and it was part of the President Clinton's first budget. That tax was raised from 50% to 85%. Right now, we didn't like that. We opposed that, and I was working on that at the time. Increasing it. It had been at 50% for a long time. As a compromise, that difference, that 15%, was applied, and it continues to be applied to the Medicare Part A trust fund, which everybody here, I'm sure, is part of the Medicare program, or most of you. So at least in the compromise on that, part of the increase was used for another program important to seniors, and that's Medicare Part A.
I might add that Medicare Part B is already means tested. Once you hit a certain level, you're going to pay more for Part B, and that's a capitated rate. It's done three times based on income. So Medicare Part B is already means tested. That's part of the program.
Means tested for the premium, but not for the benefit.
No, but for the premium, it is means tested. They're going to pay more. More you make, the more you're going to pay.
All right, next question. Yes, sir, over here.
Thank you for being here, Congressman and gentlemen. For my last career, I chose to be a teacher, took a nice drop in pay, and when I retired, I found that because I'd paid into the state teachers' retirement system, that my Social Security, I paid into Social Security for around 30 years, has been cut in half because of a misconstruing of a particular law. And every year it gets not considered and not voted on. Do you have any thoughts on that?
Yes, thanks. This comes up everywhere I go. And it is a terrible policy that penalizes folks who pay into Social Security for a period of time and then decide to become educators paying into a different pension or retirement program. And in the name of preventing a windfall to them, we have a law that basically cuts off their Social Security benefits when they retire. It's a terrible, terrible policy. I started hearing about it during last year's campaign. I promised to do something about it, and I am co-sponsoring legislation to repeal that windfall prevention policy. There is bipartisan support to repeal it, but we've had a heck of a hard time moving it forward out of Congress, and Max can probably speak to that because I know he's advocating on this issue as well.
Right, yeah, we have supported either eliminating the windfall earnings provision, or at least raising the amount that is allowed under it. And as I said earlier at the previous meeting in Mill Valley, the legislation for the last few Congresses has gotten stuck in the Ways and Means Committee, even though I think a majority of members of Congress, Democrats and Republicans, support it. We can't get it out of that committee.
That's right.
Yeah. So what do? We need to have more members of Congress that support that elected to force it out of the committee. And I think it's going to happen because the congressman says he hears about it. We heard about it this morning. Every town hall meeting, every single one that comes up. Why? It's not fair. It's just not fair.
Particularly since, as the congressman says, it's an earned benefit, not a welfare.
Yeah, the problem we've seen in high cap, especially with the teachers, you're basically in most districts forced at age 65 to rely on Medicare. You're not compensated for that. You've already bargained for your health care during your years of employment as teachers, and now most districts don't have the funds to continue that, so they're throwing you into Medicare, which you're paying that out of your pocket. You're not compensated by using some of your Social Security money for that.
Great. Next question. Yes, ma'am.
Is there any possibility that we'll ever see the cap raised on Social Security?
On the wage cap. I would like to say yes. It's a.
Not
I'm-
in this Congress.
I'm co-sponsoring legislation to do it. There is legislation in the Senate to do it, and if we could take that simple step of raising the wage cap instead of only allowing wages up to, I believe it's $113,000, something in that range, if we take that up a bit, I think it could go up quite a ways beyond that. You would not only have the Social Security Trust Fund solvent through 2033 or whatever it is, Max, but you would largely take care of the next generation after that, so it would really make a big difference. We'll see. I think our challenge is that this whole issue of Social Security has kind of been radicalized a little along party lines, and we have folks in the House of Representatives where the Republicans are the majority that want to take it in the other direction, that want to turn it into a 401k program instead of a guaranteed benefit that you earn based on, yeah. Yeah, so we'll keep working on it, and things can change, so it's important that we keep moving those bills to do that.
You know, I think it will move. There are more bills with more co-sponsors in the House and the Senate this year than ever before that address the cap, the amount of wages subject to the FICA tax. And there are a lot of ways to do it, some of them politically more feasible. There are bills that would keep it at its current level, 113,000, and start it again at, I think, 250 or 300. So politically, you're not impacting a large a group of people. But you get in less money, but you may be able to move it along. You know, Medicare used to be subject to the same cap. And then in the late 70s, it was raised to 125,000, and then in the 80s, it was eliminated altogether. So this is a process. It's a process, but I think it's inevitable. Partly because a lot of people, I think you're pretty well informed, but I've met a lot of people who don't even realize there is a cap, because they've never even dreamed about making that kind of money. So they assume you pay Social Security on all of your wages, and they call it a loophole. So I think it's a process. It may be done in stages in different ways, but I think eventually that will be part of the solution for having real long-term solvency for Social Security.
What I have wondered with that is that because most of the opposition coming from big corporations that employ a lot of people because they'd have to pay their share of that. Is that where
That's part of it.
There's a real strong policy rationale for making that change, because this wage cap was always meant to be set at the level of 90% of wages in the country. And the problem is, in recent years, all the wage growth has been at the top. We've seen this income disparity, and so you now have lots of corporate CEOs who may make $113,000 in the first week of January. And they're all done paying into the Social Security system after the first week. And it's not covering 90% of wages in this country anymore. It's much, I don't have the exact figure, it's about 80. So there's clear policy justification to take it up, to keep it at that 90% target. Anything to add on that? Okay. Next question. Yes, good to see you.
Yeah, it's good to be here, and I think it's great that you guys are doing this. My question is pretty simple. As a financial advisor, I've gone through certification for Social Security and Medicare. I think it's a 40-hour certification, and I have a binder on my desk. It's at least 3 inches thick of part of the rules and regulations of Social Security. Has anyone, you know, it's so complicated. When I talk to someone about, should I take it at age 63? Should I wait till I'm 70? You know, what about a widowed individual? You know, disability enters into it. It's extremely complicated, and for someone that's relatively educated and certified in this area, I grasp at trying to understand it. Have any of you ever talked about simplifying it a little bit? You know, make it simple. The average person can't really understand. I mean, you know, come on, give us a break here. Social Security, we all have to do it. Thank you very much.
I'm going to, thanks for the question. I'm going to hand this off to Al because he does a lot of intake for seniors trying to navigate these things. But I will say yesterday at our town hall like this in Ukiah, we were joined by someone from the Social Security Administration. And he explained how he's always trying to bring people to the Social Security website, which I think is myssa.org. Thank you. And I'm told that it's become much more user-friendly and tries to help navigate and make it simple. But Al's going to have other ideas.
Okay. One of the things that we do at Senior Advocacy Services, we publish a website. It's called senioradvocacyservices.org. We publish all the information for Medicare on there. We try and keep that as simple as possible. Good. So you can use our website. We're also available 5 days a week, 8 hours a day at least, and you can most certainly contact us. We deal with it every day. That's our job. We're there to navigate for you. So just give us a call. That's what we're there for.
Anybody think about simplifying?
I wish there was a simplification, and at some point we may get there.
Paul Ryan has ideas about simplifying. They're not good ones.
Let's not talk
Yes, in the
about
back.
that.
I'm Lillian Powers from Petaluma. I have a question about Social Security, because when I drew Social Security 40, 50, 60, probably 80 years ago, it was dependent upon how much you made. And I've heard a lot of stories about people not making anything being on Social Security. And I think there should be some transparency there to figure out who is getting it and who isn't.
Well, you have to, it depends on what part of Social Security. To get benefits, you have to work, you have to have 40 quarters of earnings. That's a total of 10 years. And that's the minimum to get benefits. But, you know, there are survivor benefits, there are children's benefits. The thing that's important to me, and I think to many people, is to understand that Social Security is insurance for families. 3.5 million children get by because Social Security is there for them, because they have a parent, a working parent who's become disabled or died. So it's a yes, you don't have to pay in the case of being a survivor, a surviving spouse, or a child, but the basic benefit requires 40 quarters or 10 years of employment. But I hope, you know, there aren't too many young people. You may be one of the youngest people here. Sorry. But I hope you help us explain to younger people that Social Security is for families and is an insurance for families. If you are a 27-year-old worker with a spouse and 2 children, you have right now, never mind when you retire, you have right now about $500,000 worth of life and disability insurance for your family. So younger people who don't have a lot of faith in this program, and I think that's misguided, also need to know it's a program that's there for them right now. 30% of Social Security benefits right now go to non-retired workers, survivors, spouses, disabled, children. So it's a program families need to have and should have a stake in.
Somebody remind Paul Ryan of that.
Well,
He was a
Paul Ryan.
He was a substantial beneficiary.
Paul Ryan got survivor benefits. His father died when he was 50 years old. I've heard the story from him. And he came home and found his father had a heart attack. Paul Ryan was 16, he got survivor benefits. So, you know, it didn't sink in, I guess.
Next question. Yes, in the back.
My name is Rick Mullen. I heard earlier you were talking about you delivered 1 million petitions.
2
million, sorry. And I just want to know, because I get emails all the time from Credo and other organizations that say, sign this petition. And I want to know, how effective is that? And if seniors all got together and started sending these email petitions, which are so easy to do, does that have any real effect on Congress? And, you know, I appreciate that you're a freshman congressman, but surely you've talked to some of your colleagues about such things, so I'd like to hear your input on that.
Yeah, well, I'll speak to it as a member of Congress, and others may have different perspectives, but I think petitions can be very helpful. The way NCP SSM does them, I think is very effective. These blue sheets that Max has here come into congressional offices, and they're things that I can take to my caucus leader, Nancy Pelosi. We can present them to the president, and they're focused on the issue that we all agree on and the outcome that we all want. Now, we live in a petition-friendly world with the internet and everything, and there's all kinds of different petitions. And we've had petitions on this issue, even though I've had a very specific opposition to chain CPI, have voted against it, spoken against it, co-sponsoring legislation against it. There are petitions circulating even now to suggest to you that I'm somehow soft on chain CPI, and they're just not true. They're not factual. Especially when you have a group that agrees on the issue, we need to be working together instead of trying to nitpick and pick fights among people that should be on the same side. The place we need to focus our advocacy on this issue, if you care about protecting Social Security, if you care about protecting Medicare, there's 2 places we got to focus: the President of the United States and the Republicans and the members of Congress who have not even taken a position on these issues. It's as simple as that, and NCPSM, SSM just does a great job of focusing right in on that.
You mentioned Credo. They were the 2.1 million petitions we wheeled to the gates of the White House. Credo was included in that. The National Committee, the Alliance for Retired Americans, there were 5 or 6 other groups, and we combined the effort. We had a press conference. We had members of the Senate and the House. It was on CNN. Ernie had to move the boxes, so I know he remembers it well. But it was a big deal. It got a lot of attention, and it's not just a one-shot deal. We got to do these things over and over again, and have town hall meetings, not just with our friends, which Congressman Huffman is, but with some people who aren't that friendly on the issue. And that's what we did in Colorado. That's what Ernie did in Delaware a couple of days ago. So I'm optimistic. I think it's moving. This whole issue on COLAs and chain CPI is moving our direction.
Yes, sir, right there.
Bill McNicholas, I have a question. What effect is Obamacare going to have on Medicare and Parts B and D coming up in the near future?
Great question. I'll start us off, and then I know these gentlemen will have more to add to it. But the bottom line, as I see it, is that Obamacare, or the Affordable Care Act, is really, really important to contributing to the stability of Medicare, and really contributing to the bigger problem that's going to help, a bigger opportunity that's going to help save Medicare, and that is bringing down healthcare costs throughout the healthcare system, and not just tinkering around with benefits to seniors. The reason that you see this few projections of deep insolvency for Medicare is not that Medicare doesn't do a great job providing health insurance. It's the most efficient form of health insurance we've ever found. It does a great job, but it ensures a very discrete pool of beneficiaries that happen to need the most health care. They're seniors. They get sick more often. They consume more health care. And so it's very tough to make the numbers work, especially in a dysfunctional healthcare system that is based on this fee-for-service situation that creates higher and higher costs. So We've got to do all sorts of reform. The Affordable Care Act, back to that, is one of the best things we've done in a long, long time to reform that fee-for-service cost trend and to move us towards wellness and prevention and a bending of that healthcare cost curve. It's already started to happen. One of the reasons our deficit is declining so significantly, and just in this fiscal year, we've seen it come down from close to $1 trillion to now just over $640 billion in less than 1 year. It's because healthcare costs are rising much more slowly than they were projected to rise, the slowest rate of increase that we've seen in over a decade, and part of that is due to the reforms in the Affordable Care Act that are starting to kick in. The other piece of this, of course, is that we're going to, the Affordable Care Act has prescription drug benefits that are important for Part D. But I'll let these guys chime in on the specifics.
Especially for Part D, I think you're creating a bigger pool, a bigger cost pool. The funds can be negotiated probably for the drug companies. The prices can be negotiated. You're looking at a much larger field with people included in it. And Congressman mentioned earlier in one of the other meetings that what would be a very big advantage is Medicare for everybody. Instead of a single payer system, Medicare for everybody. It'd get everybody on board. It would create a really great pool that way.
Well, I mean, we don't have hours here, but the Affordable Care Act is a real boon for seniors. And I know during the last couple of congressional elections, I'm sure you heard it out here, Obamacare took all of these $600, $700 billion out of Medicare, and the implication was that seniors would suffer. $748 billion was saved out of the Medicare program, not by increasing beneficiaries' costs, not cost sharing, but reducing reimbursements to providers. That money was used, a lot of that savings was plowed back into the Medicare program. You know, for the first time now, if you're on Medicare, you can get all this preventative care, colonoscopies, mammograms, diabetes screening, no out-of-pocket cost, for the first time ever. And that was paid for by the savings by reducing reimbursement rates to providers. A lot of these, Congressman's right, a lot of the reduction in the deficit is due to lowering the cost for Medicare, and a lot of the savings don't even begin till this year and next year. So it's gonna, I think we're gonna see some other benefits. The donut hole is closed. 8 years was added to the solvency of the Medicare program because of the money that was saved was put back into the Medicare program. So it really bothered me, that's an understatement, to listen to all of these, I call them lies, about how the Affordable Care Act hurt Medicare beneficiaries. It was not, was not true at all. It is not.
Yes, ma'am.
That's another thing we can see also is using an electronic reportability system is that it makes the programs much more efficient, at which will be a cost savings as well.
In the back, yes.
So the Obamacare, you can negotiate drug prices, which was drummed out of in Social Security when they redid the benefits. It was, you were not allowed, the government was not allowed to negotiate drug price.
That's the Medicare Part D,
right.
where it's explicitly prohibited.
Right, and so when I read articles, drugs that people in France and England pay $4 and $5 for, we pay $40 and $50. So Obamacare has done away with that. You can now negotiate.
No, we still need to fix that. Yeah.
Is that,
it's a problem.
Is that on the agenda?
Yes, it is. And in fact, it's proposed in the president's budget, I believe. At least rebates are going to be available. And yeah. Liz, good to see you.
I want to talk about single-payer plans.
Okay.
Now, I noticed that now they're not using the word single-payer plan, they're calling it the Affordable Care Act.
Well, so Liz, you're asking about single-payer health care.
Yeah.
We got a lot of terms flying around here, so let me see if I can clarify a few things. The Affordable Care Act is not single-payer. I think lots of us wished it had gone further in the direction of single-payer with a public option to compete with private insurance at least. It didn't. But it does do some very important things in terms of bringing millions of Americans under the umbrella of coverage and incentivizing better primary care and bending the cost curve and many, many things, preventing lots of terrible abusive practices like denying coverage to people with pre-existing conditions and so on. The separate concept is just going all the way to national health insurance, which has in the past been called single payer. In the last town hall we had in Mill Valley, the point was made that I strongly agree with. The single payer is kind of a confusing term. No one really knows what it means. One good way of thinking of it would be Medicare for everybody. That's really what we're talking about. A system where maybe you don't have to wait until you hit retirement age to get into Medicare. Maybe you could buy in early, or maybe it could just be provided to you as a return on some payroll tax, something like that. That's what every other industrialized country in the world does. At some point, I think eventually the United States will have to join them as a matter of economics and global competitiveness, as well as fairness and the human right to health care. But for right now, single payer is not in the mix with either Obamacare or the Medicare issues we're talking about. It's a long-term aspiration that I want to keep supporting, and I am co-sponsoring legislation for that kind of national health insurance, Medicare for all.
When will we be able to get the insurance companies out of healthcare?
When will we get the insurance companies out of healthcare? It's gonna take some time. I don't have an answer for you, Liz, but I'm certainly doing what I can to take us in that direction. Yes, Stan.
Vermont is already doing it. The Vermont legislature passed the legislation. The governor signed it in January of 2011. And they're currently negotiating with the federal government so that on January 1, 2017, Vermont's state program can be substituted for the federal program. Any state can do that.
That's the waiver issue.
If you can show that your program is at least as good as the federal program and costs no more. So that's the opening for single payer. Hawaii's on the same track, and we're working here in California to get us to become state number 3.
Yeah. Thanks for that point. One other way we can move towards, I'm going to call it Medicare for all, but you're going to maybe say single payer, is to allow states to do this on a state-by-state basis. That requires a federal waiver, may require some action by Congress, and I certainly support that. Because why would you prevent states from innovating and being the laboratories of democracy that our federalist system, intends them to be? Yes.
Being here, gentlemen. My name's Colleen Campbell. I'm actually one of the senior assembly people for Sonoma County to the California Senior Legislature. One of the issues that we've discussed is fall prevention. It's a piece of the preventative services in Medicare. And the problem with it is that although Medicare has authorized payment for fall risk assessments, they're not getting done. No one gets them done. And as a matter of fact, we didn't even know that it had been authorized until somebody from HICAP told us that it was buried under preventative services. But the problem is, apparently, people don't know to ask for it, and physicians and healthcare providers either don't know they're supposed to be doing it or should be doing it and don't know how to bill for it. So the result is it doesn't get done. So my question is, how can we bridge this gap between, yeah, okay, we'll pay for it, and the service actually being provided?
Yeah, I'm going to let Al dive in on this. This is right in his wheelhouse.
That's part of our job, is part of our outreach, is to contact, whoever we can, wherever we can, to let them know what benefits are available to them, and that's one of the things we do educate on. So we're trying our best.
I think the biggest issue is that healthcare providers are not aware of it, and they don't know how to bill for it. So it's almost like, and I tried to contact CMS, which got me nowhere. So I'm sort of hoping maybe your office can contact them to let them know they need to be getting word out to healthcare providers that this is a service.
That sounds like common sense to me. I mean, fall prevention, talk about something that's going to save money in the healthcare system. Yeah, the data is probably overwhelming.
It's seniors account for about 12% of the population, but over 40% of the hospitalizations for injuries, and they're all false.
Yeah.
So it's huge and growing, and it's the healthcare providers that need to get on board, and the big thing they need is how they bill for it.
Thank you very much, and let's keep in touch. I think my office would love to have that information, and we'll help in any way that we can. Yes, ma'am.
Hi, my name is
Yes, you
Barbara,
are.
and I live in Petaluma. And my experience with politics these last many years has been that we have a lot of rhetoric and little action, and I'm really concerned. And I think it takes aggressive tactics on the part of Democrats to stand up to what's happening all across this country, not just with, you know, I'm ready to retire and I'm not going to because I really can't afford it, because of what has happened to me in the loss of my financial security and a lot of other things. So I have to work until a later age. And to have it now, to be told that it isn't going to increase, and I've worked my entire life, it's really frustrating. So my question to you is that I looked at the Grayson-Takano letter, and I also read your response. And I really didn't understand it because, to me, we need aggressive tactics because we're being mowed over.
I'm happy to speak to it. So Kim, let's dive right in, because I'm happy to speak directly to that. The issue,
Nothing has happened.
I understand, I understand.
And it's rhetoric for
Let me, if I can, I'd like to answer your question. And I appreciate the passion that you're bringing to this. So you've all got flyers on your chairs that have been circulated. I'm going to explain the question, and it's in the flyers that folks have distributed, and this is democracy, and this is a public forum, so I'm happy to be part of an event where all views can be presented. But there's a bit of a debate that has occurred not on whether we should oppose chain CPI and other reductions in benefits on Social Security and Medicare, but rather how we express that opposition. And some have been critical of me because I've signed a letter with over 100 members of Congress to the President stating my opposition, but I didn't sign a different letter. That other letter was sort of an absolute vote pledge for all future votes. And the reason I didn't sign it is very simple, and I've explained it to many of the folks that are circulating this, but they don't like my answer, so they continue to circulate it. And the bottom line is I oppose those kind of absolutist vote pledges as a tactic. I opposed them when I was a state assembly member. I said during the campaign last year that if I got elected to Congress, I would not do them. And I have kept my promise not to do them. It's a position that's based on having watched these kind of tactics, especially with Grover Norquist on the tax issue, contribute to an absolute paralysis of our Congress. And so we agree on the need to fight the fight, the need to have strong positions to defend these earned benefits for seniors, but I am going to have that fight and express my position in a way that I think is more conducive to getting Congress to work again. And that's really it. I don't sign absolutist vote pledges, but anyone who tells you that means I'm somehow soft on Social Security Medicare, well, we're here today, right? Because I'm trying to fight the fight against those who want to reduce benefits to Social Security and Medicare, and you should not worry for 1 minute about my position on those issues. Yes, sir.
Congressman, my name's Don Weisenblum, and this is, seems to me that the problem is really coming up with the money to take care of the earned benefits under Social Security and Medicare that the taxpayer have paid into. And I see a glaring problem with the Congress, as this lady did a minute ago, and nobody's getting off their butt and doing their work. In 2004, news agencies posted that California taxpayers pay $10.3 billion a year, just Californians, to support illegal aliens. 2 years later, the agencies came out again and said it's up to $21.3 billion California taxpayers supporting illegal aliens just in California. Now this is a study that's 2006. In 2006, the country was paying $113 billion to support. Why don't we start saving some money so that the rest of these folks don't have to cut what they have earned?
Well, let me just tell you where I stand. I think your question is about immigration reform and the 10 million or so undocumented residents that we have in this country right now. I support a comprehensive immigration reform plan that would do several things. First, it would include border security, although frankly I think we've kind of already been there and done that. It would go on to address our labor shortages in areas like agriculture and high-tech workers by providing visas that help meet those needs while we try to educate our own skilled technical workforce by investing in education going forward. And it would address the fact that we've kind of created this underclass in this country by having 10 million people living in the shadows. It would give them a type of status where they could stay in this country and earn their ability to apply for citizenship in a very rigorous way that requires them to follow the rules, to comply with the law, to pay any taxes that they owe, and earn their way to a point over a long period of time. We're talking, depending on the different proposals, 13 to 15 years or more before they could even apply for citizenship. But it would give them a chance to do it, and while they're earning that chance, they could come out of this underground economy, pay taxes into the system. I've had a chance to talk to the CBO and people from the Treasury Department about the huge financial benefit that we would get from that kind of comprehensive immigration reform, and it's very substantial. It would help in a big way our ability to address the debt and deficit. We talk about Social Security Medicare. It would help in a big way to get more people into the workforce and out of this underground economy if we do that. We may not agree. It sounds like you may have some different ideas about how to address the undocumented population, but that is my position, and I think it will actually be one that helps address the Social Security and Medicare challenges that we're talking about.
I just recently read a report that was issued by a guy named Stephen Goss. He's the chief actuary for the Social Security Administration. And he was asked by some, I don't know if it was the House or the Senate, I can't remember, what would be the impact of the main immigration reform proposals that are being discussed now on Social Security. And it would improve the solvency of the Social Security Trust Fund. Why? Because you would have more people, if they're legal, not being paid under the table, but being paid wages that would be subject to the payroll tax. And this is what I found especially interesting. A lot of the people who are undocumented now are younger, so they would be now paying more because as a proportion they're younger, and not as many of them are older. So you'd have a big influx of working people who are getting paying FICA tax, and the proportion of seniors who would become eligible is much smaller. The bottom line is it would be a plus in terms of, I'm just talking about Social Security, I'm not talking about any other aspect of it. And I thought that was pretty revealing.
Yes, I see a gentleman's hand in the back.
Thank you. I must admit, I feel like a lamb amongst wolves politically in this group. These town hall meetings are very important, and they're certainly of interest to me as they are to other people. And I'm sure you, Congressman Huffman, want to represent all of your constituency, not just the liberal side. As such, it would be very helpful to me if next time you have one of these town hall meetings and subjects are discussed that are have different points of view politically, conservative and liberal, that you have someone from the other point of view up there with you to help explain the other side's point of view. That having been said, I have a comment from the first person who, if you hold that a moment.
Sure.
I've been waiting all this time.
No, you're doing great. I'm not going to interrupt you.
The first person that commented about Social Security and means testing, I'm one of those folks. I'm 69 years old. I retired 30 years out of the military, and I have a business in Sonoma where I employ over 30 people. And I'm one of those people that make money that would fall into the means testing should that be done, as it is done, and you pointed out, with Medicare B. It costs me, for my wife and I, over $10,000 a year in Medicare tax, because I still work. And I was supposed to have that medical free because of 30 years in the military, which I don't have, for what that's worth. Okay, so I'm paying my fair share, believe me. I would be more than happy on Social Security to stop collecting Social Security if Social Security will pay me all of the money that I've paid into it for the last 50 years and continue to pay into it with interest, and I'll take interest at 4% per year compounded, which is a pretty good deal. Now, back to my question.
All right. Well, first, I want to thank you for being here. And I do want to hear from everybody. I do want to work to represent everybody. I think Social Security and Medicare, though, are really programs that cut across party lines, or at least they should. And that's kind of the way I approach this. I don't see this as a partisan issue. And the sort of rhetorical point about, I'd like to get back everything I paid in and approach it that way, that's really not the way Social Security is set up. You have lots of people. My father died at age 56, paid into Social Security all his life, didn't draw one penny out of it. And that's sort of the way it is when you talk about this kind of national pool of folks that pay in, that take out. Not everybody's going to get out what they paid in. But the huge benefit that we're going to get as a society is the people that reach a point where they actually need it will have it, and they can count on it.
That answer explains exactly why we decided to support Congressman Huffman when he ran for Congress. That's exactly the answer.
Your time signal.
Okay.
It's nice to see that there's an opposition here to that. Only thing is, I think the congressman has been very, very pointed about his positions. It is nonpartisan as far as Medicare and Social Security is concerned. And I can see from the last 2 town meetings that I've done with him that he's really, really forefront in supporting both.
If you can point me to a Republican leader that wants to strengthen Social Security and Medicare, I'll put him on my panel. I promise you that. So I think I've got time for one more question, even though I know I'm going to get in trouble from my staff. So let's go over here. Yes.
All I wanted to say was I have actually a comment and a question.
Okay. You're getting me in even more trouble with my staff. Go right ahead.
Fee for service. Can you clarify what you mean?
Yeah, thank you. I'm sorry, we use jargon sometimes. When I said fee for service, what I'm talking about is a healthcare system where your various specialists that you see don't talk to each other. They don't make their money based on the overall outcome and the overall health plan that leads to wellness. They make their money based on how many procedures come out of all these different visits. And so you get bumped around from one specialist to the next, and there's nobody really looking out for whether you really even need this procedure or that. And it's that kind of siloing of our healthcare system that is causing costs to go through the roof. And some of the ways that we know that we can change that and make it better, Kaiser, frankly, has done. I see someone from Kaiser here in this room. Kaiser's done a nice job of trying to create a team practice of medicine where they try to do what's right for you, not necessarily to just bounce you around between specialists. And your health clinics, your rural health clinics, your community health clinics like you have here in Petaluma are wonderful places that do that very same thing.
So you weren't saying that doctors shouldn't be paid?
No, I was not suggesting there should be no fee for their service. Yeah, thanks for that. Doctors should actually be paid for the work they do. Let me. I'm going to go on record with that.
Yeah. Here was my other question. Okay. I enjoyed the last speaker. I was hoping that you could have more town halls and deal with other things besides Medicare and Social Security. I think that we're facing a lot of drama today, especially between the IRS and healthcare coming up, and some of the problems that we're starting to percolate up. So I'd really like to see an open discussion of those issues.
That's a perfect final question, because it gives me a chance to sort of talk about where I would like all this to go. I do want to do more town halls, and I want this to be the beginning of a discussion on these issues, not kind of a one-time deal. My sense is it's going to be a long time before we fully get a handle on a $16 trillion national debt, and before we bring these deficits down to a manageable percentage of our economy. It's going to be years. And until that time, you're going to continue to see these earned benefit programs in the crosshairs of some people in Washington. So we're going to need to stay engaged. But equally important, there's other parts of our healthcare challenge. There's other parts of our various national debate that need to be talked about. So I will have more town halls. I'll come back to Petaluma. One issue in particular I know I want to focus on is the rollout of the Affordable Care Act, because it's coming. You're going to start to see these exchanges coming online in October. Everything goes live January 1st, and that's not that far away. And in the meantime, I have small businesses and others that are, hearing from their friends that this is going to somehow hurt you and force you to do all these different things. Often it's just a lot of misinformation and confusion. And so I've got to contribute to helping inform people about how this is all going to roll out, how they can get the kind of benefits and care that they need. More often than not, we've found that the answer to these questions and confusion points about the Affordable Care Act is usually good news. It's usually something really good that is going to happen. But unfortunately, my colleagues across the aisle have used their majority in the House of Representatives to block funding for education and outreach on the Affordable Care Act. And so even though we're moving forward with all these hard dates, we don't have the funding to actually tell people in the kind of robust way that we need what they need to know. And so we're all going to have to do it. I'm going to have town halls, and I'm going to need all of you to be part of that process too, and my office will have to be a resource. I know that Al will as well. So with that, I just want to thank you. I want to give Max and Al a chance for a final word, and then we'll, I know my staff is going to tell me to urge all of you to sign the sign-in sheets, because I get that at every one of these, but we'll get that as the final word.
Personally, I want to thank you on behalf of HICAP and Senior Advocacy Services for having this format for us. I want to remind you all that open enrollment, October 15th through December 7th, you need to contact us every year to make sure that you are being provided the best service that we can help you navigate through.
Well, I want to thank all of you, Congressman. I'll be glad to come back to Petaluma anytime. It's a beautiful place, and I appreciate you inviting me. You have a big challenge. You're not only going to have to fight a House majority that's determined to move us back into the 19th century, but some aspects of the president's budget. So I just wanted you to put these on and keep fighting for your folks. Thank you so much.
Please join me in thanking my fellow panelists, and thanks so much to all of you. We'll see you next time.